Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program.
I'm here to give you enema.
Oh, wow. Okay.
I know. We'll try to get it done quickly.
Gotta happen, all right.
If you are permitted to administer an enema in your facility and state, first provide privacy by closing the bedside curtain or the door to the
Lay
room.
your head down.
Okay.
With the side rail up, lower the head of the bed. Then raise the bed to a height that's comfortable.
I have to uncover you, but I'm going to give you this blanket.
Okay.
Cover the patient with a bath blanket and pull the top linens to the foot of the bed.
Okay? You hold the ends of it for me
All
there.
right.
Okay, keeping your legs straight, just turn to your left side for me,
Okay.
please.
Have the patient turn onto her left side with her right knee bent.
Lift the
Assist her as needed.
All right.
Perfect.
After putting on gloves and lowering the side rail nearest you, place a waterproof pad under her hips and buttocks. Ask the patient to lift her hips if she is able, and tuck the pad under her.
Can you lift your hips a bit for me?
Yeah, I'll try.
Perfect. A little bit more.
Okay.
Okay. Now
right?
before
Expose only the rectal area and make sure you can clearly visualize the anus. Separate the patient's buttocks and observe the rectal area for abnormalities, such as hemorrhoids. Position the commode or a bedpan for easy access. If the patient will use the toilet, make sure that it's available and that her slippers and robe are handy. To administer a commercially prepared enema, remove the plastic cap from its tip. If the tip is not pre-lubricated enough, apply more water-soluble gel. Expel any air from the enema container.
Okay, I'm going to uncover you a bit. Okay. I'm going to ask you to take a deep
Separate the
breath in
patient's
and
buttocks and locate the anus.
Insert the
Have her relax by breathing out slowly through her mouth.
Ready? 1, 2, 3, take it.
Gently insert the tip of the container into the anal canal, angling toward the umbilicus. Adjust the insertion depth based on the patient's age. For an adult or adolescent, insert it 2 to 4 inches. For a child, insert it 1 to 2 inches. And for any patient, do not force the tip if you feel resistance or if the patient reports pain. Continuously squeeze the container until all the solution has entered the rectum. Stop squeezing if the patient reports abdominal cramping, expels the solution, or cannot hold the solution. Finish administering the enema when the symptoms subside. Then place toilet tissue around the tube at the anus and gently withdraw the tube. To administer a cleansing enema using an enema bag, check the temperature of the warmed solution by pouring a small amount over your inner wrist. If required by facility policy, use a bath thermometer to get the water to 105 degrees Fahrenheit. If directed, add Castile soap and mix the solution. Add it to the bag. Raise the enema bag, release the clamp, and let the solution flow just until it fills the tubing. Reclamp it.
Okay, Mr. Mays, we're going to get started with your enema.
Okay.
When the enema and patient are prepared, use a lubricant gel to lubricate the last 3 to 4 inches of the tip of the rectal tube. Gently separate the patient's buttocks and locate the anus.
Okay, now I want you to take a big
Instruct him to relax by
Let it out and
exhaling
relax.
slowly through his mouth.
You're going to feel a little pressure.
Gradually insert the tip of the rectal tube into the anal canal, aiming it toward the
Is that
umbilicus.
okay, sir?
As you would for a disposable commercial
Mr. Mason.
enema, adjust the insertion depth based on the patient's age, but do not force it. While continuing to hold the tubing in place, open the clamp and let the solution enter slowly, with the container at the patient's hip level. Gradually raise the enema container above his anus based on the charge nurse's instructions. The height of the enema bag controls the force and rate at which the enema solution flows through the tubing. For a high enema, raise the container 12 to 18 inches. For a regular enema, raise it 12 inches. For a low enema, raise it 3 inches.
You let me know if you start
Vary
feeling
the
cramping.
installation time with the solution volume as instructed by the charge nurse.
It'll be just a few more minutes.
Lower the container or close the clamp if the patient reports abdominal cramping, expels the solution, or cannot hold the solution. Finish administering
Now,
the
Mr.
enema
Mays,
when
we're
the
just gonna slide
symptoms
this out,
subside.
okay?
When all the solution has been instilled, clamp the tubing. Place toilet tissue around the rectal tube and gently withdraw it. For either type of enema, explain that mild distension and abdominal cramping are normal.
Feel a little fullness and maybe even cramping. That's all normal.
All right.
I'll be back in a few minutes.
Ask the patient to retain the solution as long as possible while lying on her side in bed. Place the call light within her reach and tell her to call if she needs assistance. Discard the disposable enema container properly or wash a reusable container with soap and warm water and store it according to facility policy. When the patient is ready, help her onto the bedpan or commode or assist her to the bathroom.
Okay.
Remember to observe the amount, color, and consistency of the enema results. If needed, assist the patient with washing the anal area with soap and water.
Thank you very much.
Thank you so much.
As part of follow-up care, assist the patient into a comfortable position and ask if she has any abdominal discomfort. Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.